Go live now. He's now.
Hi, everyone. Welcome to another inspiring conversation. Today, we're joined by three remarkable leaders who are transforming community healthcare through education, outreach, and early detection. Sister Allison Andrew from Mediskills Academy, Kerusha Pillay from Healthful Scientist, and Janice Benecke from PinkDrive are here to show how collaborations is making healthcare more accessible and empowering South Africans to take charge of their well-being. Let's begin. How are you, Janice?
Hi, I'm fine, and you?
I'm awesome, and I'm excited to have another live chat with you all
Yeah,
once
we are
again.
very excited, and good morning to all the listeners. I'm starting off here at the Miracle Tabernacle, where we are celebrating Mandela Day. I thought I'd just give you a chance to see our mobile clinic.
Wow, it's beautiful.
Okay, and then we're going to go inside, and I'll show you what's going on inside. You can follow me.
Mhm.
So there is a little bit of singing. We have asked them to sing it down so that we can do the interviews with. I'm going to take you to all the stands so that you can
Sure.
see what services and everything is going on here today.
Awesome.
This is the reception area. Good morning. Hello, how's everything going here today? So we are here today to celebrate Mandela Day here. And here is Sister Allison. You can say hello to Sister Allison.
Hi,
How are you?
Hi, Alison.
Okay,
Good.
no, you can say.
How are you? Are we on already? No.
Yeah, realize.
Show here, over here, so one of our first services. Hello. I'm fine, thank you. Would you like to introduce yourself?
Hi, I'm Dr. Naveen Narayan-Samy, and I'm an audiologist based at Specsavers Gateway.
And you're young.
And we're here with PinkDrive today.
Thank you for coming today. We really appreciate it.
You're
Okay,
welcome.
come with, let's go. So we are going over here. Here is our first one. Show off here. Say hello. Your name?
I'm Ria with PinkDrive and Mediskills, and I'm doing wound care, my wound care specialist.
Okay, you ready? Come. There's some patients waiting here. Say hello, everybody. Good morning. Hello. Hello. How are we today? Are you happy that we are here? And here is my friend. Come and introduce yourself to everybody. So he is here with Boomer, and I'm going to let him introduce himself.
Hi everyone. Sorry, I'm bad with introduction. My name is Mumi, separated from Muma and Hyper. So we just deal with connecting everyone, making sure everyone stays connected each and every day. Our fund is prepaid, no more contract pays. So that's what we do.
And what are you doing here today?
No, today we only go Janice. Anytime Janice calls, we
You go everywhere. And what are you giving everybody here today?
So today we just we are
Tea and
responsible
coffee.
for tea and coffee.
Oh, no, sister. Yes, and screaming. So he cancels his other appointments when PinkDrive asked him to come and be at one of the events. He's supposed to be in Joburg, but he's not. He's here with us today. So thank you.
They called me back tonight. I'm supposed to be there.
Yeah, but he's here with PinkDrive. So we like to have loyal supporters like Boomer, such a big company that will come here and supply tea and coffee. And on Valentine's Day, everybody got a rose and a muffin and all sorts of things from Boomer. So we thank them for being here today. Thank you so much. Okay, and here is our next one that we are at. We are here today with Maria. Can you just say why you're here today and what you're doing?
I am an assistant by profession. I'm a diabetes specialist nurse practitioner. I own Alpha Healthcare and Equipment, which is the holding company. Our foundation is Alpha Healthcare and Equipment, which is the foundation. And we offer diabetes education and support.
So thank you so much. You are here also as well to support Mandela Day.
100% through PinkDrive, we are here today to support Mandela Day. And we have a massive initiative through the support of Order Care, who offers a range of monitoring devices. Our ladies through the FOSA and sisters, Sister Allison, are doing blood cholesterol screening through the support of Order cholesterol strip at no cost. The big
How nice
drive.
is that? How nice is that?
The big drive is that we believe in 67 minutes. Therefore, we target 67 cholesterol tests today for the prevention of heart disease.
And this is the machine.
Order is a massive support of whole monitoring as well as healthcare professional monitoring. Belinda, our local support in KZN, has been amazing to support the whole initiative of Mandela Day through PinkDrive.
Thank you very much.
And there we have Sister Allison from Mediskills Academy. Sister Allison, can you say a few words for us?
Hi, how are you?
Fine, thanks.
I'm just so glad. You know, Mediskills was asked to do so many initiatives for Mandela Day, but I think this is where we wanted to be. You know, healthcare is for us. We're passionate about healthcare, and Shirley reached out to me from the Doctors Society, and thank you, Shirley, for having us. And so Mediskills called in all our collaborators like PinkDrive, and we've got Alpha House, we've got Hyper. I think we're going to go to all of them. And yeah, we want to give our 67 minutes back to the community for healthcare.
Good day, my name is Shirley. I'm presenting the Doctor Society for Social Harm Development. And this was like a divine appointment by God, because the 67 minutes to give back to the community was just, I think, a divine appointment, because I just chose the day and I never knew that it was the Mandela Day. So I'm so glad for all the service providers, together with Allison from Mediskills and the PinkDrive and every other service providers that are here this morning. And we believe that when we give to God, we're actually giving back. When we give to the community, we actually give to God. And that's what God wants us to do. And all our community initiatives are based for people that cannot give us anything in return. So we love to do what we are doing. And thanks once again to all of you.
Thank you, sir. Thank you, Helen. Thank you.
Sister Allison, would you like to say anything else?
Look, we'll go around to all the service providers, and again, once again, whoever's watching, please come through and join us.
Yeah.
It's 85 Crimby Avenue, and we'd love to see you here. Shirley is waiting. We've got all the services. We've got an audiologist. We've got Janice from PinkDrive. We've got Hyper. We've got Alpha. We've got, who do we have on that end? We've got FOSA. We've got
Which
health
we're going to
scientists
go
as
over
well.
there now.
Janice will take you through. Thank you.
We'll see you again, Sister Allison.
I'll see you again.
Thank you very much for coming here today and spending Mandela Day with us.
Thank you, PinkDrive, for having us, and also Mediskills, and also AFM Tabernacle Church. I'm so happy to be here.
Awesome.
All right, so Health Authority is here today to talk a little bit about gut health. So we're doing health awareness, and we're trying to educate people about how to actually take care of themselves, what gut health actually means, and what sort of movement we can do, what food we can have, how we can improve our gut health, because gut health is very, very important. Our immune system lives in our gut, and if we don't take care of ourselves, we're going to have a lot of problems. And so we're here to talk about that today, but we also have Yogam Yoga, and we have Prasanna from Yogam Yoga, and she's going to do some yoga demonstrations, and we're going to chat a little bit about what we can do. And yeah, it's been a lovely day with the community. So thank you for joining us, everyone.
Thank you very much. Thank you. Okay, come with me. I'm going to take you now to the. I'm going to show you the PinkDrive step master. So this is my stage where I am today. In this gazebo, we are doing breast examinations. And in this gazebo, we are doing pap smears, which were kindly sponsored by Lancet Laboratories. They've given us 50 pap smears for free to celebrate Nelson Mandela Day. Now, how nice is that? And Sister Allison has helped me with some nurses from Mediskills that are helping me with the paperwork so that I can walk around and show you everything that is going on. And we are very happy here
today to be here to celebrate Nelson Mandela Day. We also would like to thank Tiger Brands, who have kindly given us boxes and boxes of Easter eggs for us to hand out afterwards. So a lot of people are going to get really treated, and also Imperial for giving us Dr. White's sanitary towels for us to hand out for the medically uninsured. So we are here today in a big way, and we are really happy to be here. And I'm going to take you here to show you over here. This is where we are doing more cholesterol, diabetic screening, blood pressure. That's everything that's getting done here today. So, yeah, so I hope that you have enjoyed this little tour and being with us here today. Is there anything you would like to ask us, since I've done so much talking?
Yeah, sure. I think since you are with me, Janice,
I
maybe
can't
I'll
hear.
start with you. Oh, sorry. Are you able to hear me now?
Then we go outside, I think. Let's just go outside so that I can hear you, because it's a bit noisy.
Okay. Sure,
And I
no
can't hear
problem. Oh,
anything that you're saying.
oh yeah, shame. Yeah, it is a bit loud there. Okay. All right.
Oh, let's show the kitchen. The ladies
Oh.
here are getting ready to give everybody nice treats and something to eat before they go home. How nice is that? Say hello, everybody. Thank you very much for all your hard work. I know you got here very early this morning to get everything ready for everyone that's here. So thank you very much. Comes with the home.
Okay.
Okay, so I can
Alright.
hear you a little bit better here. I'm sorry I had to come outside.
Okay, no, I was just gonna. Okay. No problem. I was just gonna say, since you are here with me, I'll start you off with the only one question, and then I was gonna ask Kerusha and Allison their one question. So I'll start with you, since you are here with me. PinkDrive has shown that early detection saves lives. What message would you like to share with those who keep postponing health screenings because of fear, uncertainty, or simply being too busy?
Okay, so I think that everybody needs to take time to look after themselves. You need to do your self-breast examinations once a month, 7 days after your periods, and once a year by a professional. And you can always ask PinkDrive to come to one of the events, and we will be the professionals that will do your breast examination for you. Because it's no good being scared, because if there is something there, it starts off very small, like the size of like a little pea, okay? And if you leave it, it's just going to grow and grow and grow. And it's just going to get bigger and bigger and bigger. And if you have it done early, you may not need a lumpectomy, which is where they remove some of the breast, or a mastectomy, where they remove the whole breast. So it's best. Early detection prolongs a life. We don't say saves lives, because some people, obviously, we can't save. But we can say it prolongs a life, because it does give you longer here on earth. If you just do your self-breast examinations and be responsible. Don't let your work get in your way. Don't let anything get in your way. And you also need to have your pap smears done. And that's why I say we're so grateful to Lancet for sponsoring it, because if you had to go to a gynae, what does it cost at a gynae to have a pap smear done? It's quite a lot of money. And here we are getting it done for free. So you really need to look after yourself as women. You really need to look after yourselves. I can't stress the importance of it, you know.
Awesome. All right. I will get to the next one, which I think will be either Kerusha or Allison. Which one should we get to? Probably Kerusha, I think.
Sister Allison.
Okay, so you can come back with me so that you're not looking at nothing, and I'll get Sister Allison for you.
All right, sure. No problem.
Reach all the precious name of Jesus Christ. Thank God for this. Thank God for this opportunity.
Hi.
Hi. Hi. Hi.
Sorry, we're just moving to somewhere where the sound is better.
No, no problem.
There we are.
Okay, the side, Sister Allison.
Is that better?
Yeah, that's perfect. Sister Allison, this wellness outreach program brings together free health checks, screenings, and education under one roof. In your view, how can initiatives like this transform communities from simply treating illness to truly preventing disease?
Look, the area that we're in right now is a very underserved area. And, all the services that we've brought on board, it's an amazing stuff, especially for people that don't have medical aids. And, it's just a whole lot of services under one umbrella. So initiatives like this generally bring our communities together. It's free health checks. And like I've always said in my previous interviews, for me, it's always knowing your numbers. That's the most important thing. Knowing your numbers for every health check so that you can action that and then you can obviously, get treatment. Early detection, like, obviously will, prevent so many more diseases. Kerusha, thank you for being here, my darling.
Thanks for having us. Hi,
Yeah,
Siddharth.
awesome. Hi, Kerusha, as someone passionate about making science accessible, how can better science communication empower people to make informed health decisions and embrace preventative healthcare?
So I think we all have, when we get sick, we will go to the doctors and we'll get some information from them and some results. But what do we actually do with those results and that information? How do we actually change our lives? So I think there's a huge disconnect from the information that you're able to get at a doctor's surgery and also the amount that the community can actually take in. Each community is different, and everybody wants to understand. Nobody wants to not take care of their health. They want to understand, but we have to help with the communication. We can't just say, oh, you've got this long disease and these are the symptoms and that's it. We need to say, this is why it happened. This is how it happened. This is how we can move on. This is how we can fix it. So the communication is so important because it's not just a result. It's not just, oh, now we're putting you in the box of being sick. It's like, okay, you have this diagnosis, but how do we actually fix this? How do we move beyond just this label? Because that's all it is. We labeling you as diabetic and we labeling you as this and that. But you need to put your lifestyle and put your health in order. And how do you do that? And how do we communicate that? So communication becomes very, very important. And in order to prevent anything from happening, everybody also needs to understand their baselines, their basics, and how do they fix things when things go wrong. So initiatives like what PinkDrive and Mediskills and also Health for Scientists, what we're trying to do, it's very important to the community. And I ask anybody who can help to please come along and help us to serve the communities. So thank you for having us along, Siddharth, as well. We really appreciate your time and your efforts.
Yeah, thank you very much.
Awesome. I have a supportive comment here from Rishjitan. She says, I applaud all that you guys do. Thank you. We need more like you. Okay.
Oh, thank you very much. It's our pleasure. We just love doing this type of thing, There's no better reward than someone coming and saying thank you, to help them get the services done that they can't afford to do or have to wait so long in the government sector. Sorry, but it's the truth.
Yeah, I mean, at the end of the day, we're just it takes a village to raise a child, but it takes a village to also help heal the adults that came from these villages. And so we're just creating different villages where we can communicate with each other and we can help each other, because at the end of the day, we're just humans living on Earth. So we should be helping each other.
I agree.
Awesome. All I gotta say is that thanks so much for your time, guys.
Oh, it's a pleasure. Thank you so much. And thank you to the listeners for listening.
Yeah.
And we hope to see you at one of our events that are coming up.
Definitely.
One
Take
of our
care.
other events.